very good evening to Dr. Naidu. Thank you very much for taking the time with us today. My name is NUREEN RODZUAN and I am representing from University Kuala Lumpur Business School. This interview is conducted as part of our academy, requirement for a company visit and cross-assessment. So, this purpose of this interview is to gain a better understanding of leadership practices, innovation management, service improvement, and digital transformation at Klinik Impian, particularly in relation to patient-centered healthcare services. Your insights and professional experience will be highly valuable to our study. We would like to assure you that all the information shared during this interview will be used strictly for academic purposes only and will be treated with appropriate confidentiality. With your kind permission, we would like to ask for a consent to record this interview to ensure accuracy in our analysis and reporting. So, can we proceed? Alright, thank you. With your permission, we will now proceed with the interview questions. So, the first question is, when in an unexpected event, do leaders act quickly when problems in the clinic are reported?
Depends on the situation. Depends on the situation and depends on the problems also. There are times that when a certain unexpected event comes, if the staff that actually handled before the condition, sometimes they will face it first. But in the event of when they are unable to settle the thing, then we leaders have to sit down and we have to handle the thing first hand.
I see. Okay. So
then from the state of the situation, for example, like let's say there is a complaint arise from a patient. For example, they have to handle a complaint arise from the patient. There is any aspect that they don't understand. Generally, when they have actually experience, for example, like the manager or senior staff, they have experience, they will handle it beforehand. But like when they are unable to handle it, then leaders have to take action and then become, instead of we just wash our hands away.
Alright, I see. Next question. Are leaders open to changing all routines if staff suggest better ways?
Definitely they have to change because as times is changing, sometimes the staff is actually the one facing the patient outside. Job scope that sometimes we don't see what's actually happening outside. So sometimes they will suggest, okay, for example, like in this, we can make the workflow more efficient if it's done in this way. Workflow more efficient and done in this way. We can change this kind of reporting based done better. So sometimes, many of these kind of situations, sometimes I leave it to them. Many of the situations, like for example, the manager or senior staff, they will discuss among them which is the best way can be handled.
Okay, I see. Alright, next, do leaders make decisions that put patient safety first? Like, how does the decisions usually be implemented?
Make decisions that put the patient safety first. That is the most important decision really.
Okay.
There is nothing else can be above that. Patient safety. Patient safety is the most important. In any healthcare setting, that one will come number one. Then how decision usually implemented?
Maybe what types of procedure of safety, maybe regular.
For example, that is for our safety. For patient safety, for example, like that, like now, like just now we just had one patient, for example, she had fall yesterday, bleeding from the ears. So we know that she had some kind of fracture, skull fractures and everything. These kind of patients, sometimes they won't be stable. Sometimes they can fall down from the bed and everything. So either we make sure there's some staff standing beside the patient, or sometimes maybe somebody assists the patient or the family members so they don't leave the patient, for example. So like a certain area, like the children's playing area, if we see something sharp, for example, for patient safety, the sharp there, we try to put it a bit more deeper inside, so children won't have access to it. Then we won't put like certain things that can fall on people's head. So this is actually appear to be like simple thing, but this is actually patient safety. Even from KKM, actually they have done very good regulation. For example, toilet or if we come, we will open it outside. This is patient safety. When they fall inside the toilet, you won't have difficulty to open the toilet door. You see the front door, it opens towards inside, doesn't open towards both sides. So that people won't accidentally push and hurt people actually walking on the corridor. This is example of the patient safety. We have to follow the regulation properly. But actually, I think from KKM side, they already done this kind of thing pretty good for us to follow. Problems start when we don't follow the thing.
It's alright. Alright, next. what innovations has been introduced to improve patient experience or reduce waiting time?
So patient waiting time sometimes actually one of the things is we digitalize our system around actually. Mostly like when you come the my card can be read directly by insert this one. The no more like we are preparing the medications that we have to write the labels. Everything can be printed, invoice, then detailed receipts. Every single thing is actually all in one click away. Second thing is the medication is already there, properly prepared, labeled medication over there. So this kind of thing can reduce the time, but waiting time still depends on how we examine the patient. The consultation still depends. Occasionally the waiting time can be a bit long, but we also, when in this clinic actually, staff will take the vital signs first. They'll take the blood pressure, they'll take the temperature, they'll take all these things. So when they take the vital signs and everything, by the time when the patient, they will inform me, doctor, this child temperature is very high. So I won't wait first. We won't wait until this one. They'll ask them to this one. This doctor, this patient come with a chest pain. The chest pain is this one. Appear to be this one. We ask them. Sometimes the patient come with a difficulty to breathe. So I'll go and assess first in the treatment room while I'm consulting this patient as well. So if I assess and they require nebulizer or maybe they require ECG, some stabilization, they have to handle that one first. So in that sense, it's got waiting time for stable and non-stable patients is very different. Non-stable patient, the waiting time must be very low. But sometimes when they come for medical checkup, maybe they come for formula, we make them understand that they have to wait. No choice. Some of them they will demand to come on the Monday morning at 8:30 in the morning when the patient is so busy. I want to be seen exactly at 8:30. So it doesn't work that way. Quite difficult to tell. But sometimes it's not that easy to this one because we cannot exactly make sure the consultation is long. I think a friend knows how long the consultation can go on. Then after that, so that's one of the things we can do. The patient feedback, yeah, they complain sometimes waiting for me is quite long. They say, but sometimes as long as when you treat them well, they go out happy.
Yeah,
They go out happy. That is the most important thing. Is the feeling of when they're coming in and leaving is very different. Same when you go to one shop, you wait, you're so irritated with this one, but when the person in the counter is very good, the person you deal with is very good, you feel satisfied. You forgive them straight away. The waiting time doesn't matter anymore.
Okay, next. Does the clinic support digital transformation? For example, e-payments or telehealth?
E-payments, yes. E-payments even from the clinic. E-payments is not a new thing anymore. So touch and go lah, QR code payments lah, online payments and everything. So the thing is already quite long. Most of the e-payment everybody will have in Malaysia. Telehealth we are onboarding. Telehealth, I hope actually government has to take a lot of initiative to make a very clear-cut regulation. There's a borderline medical legal thing. Whether in telehealth MC can be given. If everybody can give MC in the telehealth, what kind of condition? A person is coughing. That thing can range between simple acid reflux or simple normal cough and flu. Can be until tuberculosis or asthmatic, and can be heart attack also people with a can cough. So, telehealth is actually very wide range for it. So, for me, I agree with telehealth, but depends on what kind of condition. For example, chronic disease, patient can take their own blood pressure, they can take their own sugar, they can discuss with the doctor. I think that one is very good. Especially and especially not in a private clinic, they should really approach that. They can reduce their waiting time a lot, the congestion in the hospital and every single thing. So telehealth for me, I'm still onboarding. I'm still onboarding this one because for me I want to have very clear cut because for me sometimes the patient load is quite a lot here. So sometimes maybe unable to cope.
Alright, next, does the clinic provide training when new equipment or software is introduced?
Yes. Usually I send my manager to learn how to learn all these new things, and generally she will train the other stuff. Because of there is a lot of software, for example, every panel has their own website. Every panel has their own system. Every government website, either for notification of the disease, Madani, every single thing has their own website. Everything, even the prices can be different, how we manage it, how we submit it will be different. From my side, it's not that easy for me to learn. So generally she will learn. The brain is still fresh to learn. And we make sure we learn. Initially the junior staff is actually, we will train them to understand. But there are things that they are not allowed to do. There are certain things that still the doctors have to do. But mostly softwares, equipments all will be tested. Like for example, X-ray they are able to do, only radiographer can do. But handling the urine machine, glucometer, blood machine and everything is the problem. Generally that's what we do.
Okay. So the last question, how does the clinic enhance its physical environment or service floor to improve patient satisfaction?
For now, not so much. Actually, we're trying to change. One of it is our computer system we're trying to change. Because there's new introduction of a lot of new rules.
Okay.
There's new introduction like PDPA rules. Now people have to sign the PDPA rules and every single thing. So certain flow, we try to change it by introducing using tab for them to signature. Certain consent can be signature. They can give the signature on the then after that, other than that, I think our flow has been quite standard. Patient come, they take vital signs, they this one. Last time maybe when the patient load is not so many, I am able to cope when they call me outside to see patient, but nowadays cannot. So what I do is just adding my work hours longer. Like for example, Wednesday, Thursday, my work hours is a bit more longer. I work sometimes 7 morning until 12 midnight. So the patient who actually staying far, they can come and see. I go and do like that. Sometimes on Sundays like that, I just go to my another clinic. But after 12 or 2 o'clock, we go to patient's house to do home visit. But unable to take the emergency cases.
I see.
Is it? But I answered the question, or is my answer is not what you expected?
You answered very well.
That's what I
Yeah,
answered.
it's really good.
If you're not expected, you can just tell. Because sometimes the question and the answer are changing.
Yeah, I understand.
So far it's good. Okay. Thank you very much, Doctor, with your permission. On behalf of our team, we would like to express our appreciation for your time, cooperation, and valuable insights. The information you have shared with greatly contribute to our academic learning and understanding of innovation and leadership in the healthcare sector. Thank you once again, Doctor and Madam Manager. We truly appreciate this opportunity.
Kita jalan pelan.